Hi, I am Thokozani Ntshalintshali. I'm a medical doctor with a specialist training in oncology, trained at the University of Cape Town. My work as an oncologist involves the diagnosis and treatment of cancer patients. My role mainly is to work with the patient and loved ones and family through the difficult journey of cancer treatment, from the initiation of treatment all the way to recovery and long-term care. For me, it's the resilience of patients, more especially cancer patients. After going through a difficult journey of being diagnosed with cancer and having to go through that difficult journey of treatment, which can be very long and grueling, and it does take a toll on a patient's health and mental health. But I've seen patients who are able to pull themselves through in spite of very difficult challenges, and seeing families rally with them throughout the whole journey. And that really makes my job much easier as an oncologist, being able to assist and work with the patient and the family through this journey. What inspires me about helping cancer patients is also my own personal experience with cancer. I had a loved one who was diagnosed with cancer, and at that time, getting treatment was a challenge, and our family had to go to South Africa for my father to get treatment, and that really inspired me to go to school and study oncology so that I can be able to come back to my country and offer the treatment. Also, I'm deeply committed and passionate about palliative and end-of-life care, which unfortunately not all the time we are able to cure cancer. But in those difficult situations where cure is no longer possible, my job really continues to care for the patients and their loved ones, work with them through this difficult journey with compassion and understanding, and providing clarity to the patient and the families, and being able to facilitate symptom control and long-term care with dignity and understanding. In Eswatini, the top 5 cancers that we see a lot are breast cancer, which unfortunately in our setting we tend to see a lot of young women diagnosed with breast cancer, and also cervical cancer, which unfortunately Swaziland has the highest incidence of cervical cancer in the world. And that in itself shows you the magnitude of the challenge that we have in trying to provide treatment for these patients. And also prostate cancer, lung cancer, and cancers of the colon and rectum. As a person, you must know your body. Any persisting symptom should prompt you to seek medical attention, particularly symptoms like unexplained weight loss, chronic coughing, persistent and severe pain, new lumps and swelling, and also abnormal bleeding and ulcers or sores that are not healing. Very, very importantly, people should also pay attention to their bowel movements. If you are suffering from chronic constipation or incontinence, especially amongst young people, that should also prompt you to seek medical advice and assessment. Early detection saves lives. When cancer is caught early, the treatment is also less aggressive, and there's less disruption in terms of the duration of the treatment. And what we do advocate the most is screening. And at the clinic group, what we advocate is risk-adapted screening, which is a screening that is tailored individually based on a person's risk factors. The most important aspect is to not delay seeking help. When something doesn't feel right, my recommendation is getting early medical advice. What we also want to advocate is routine screening, keeping up with your routine checkups, and then also knowing your family history. If you have a family history of cancers, especially first-degree relative, please go and see your medical doctor, and so that they can tailor-make a screening program that is specific for you. At the clinic group, we offer comprehensive services in terms of screening, diagnostic services, and coordinated multidisciplinary care for all our cancer patients. That involves collaboration with the physicians, surgeons, the nursing team, our psychologists and dietitians, so that a patient is offered holistic care that focuses on the medical aspects, the psychological aspects, and also nutritional and well-being of the patient throughout the journey. What is important for people to understand is that cancer is no longer the death sentence that it used to be. With the right treatment and the right diagnosis and being diagnosed early, a lot of patients get to be cured. And also the ones that have advanced disease, there is also treatment that is aimed at relieving symptoms, providing comfort and improving quality of life of every cancer patient. Simple steps go a long way. Avoid smoking, and if you are smoking, try and stop smoking. Limit your alcohol consumption. Try and live a healthy, active life, meaning regular exercise and a healthy diet. And more importantly, keep up with your checkups and speak to your doctor if there are any issues of concern about your health. And since we are in Africa and in Southern Africa, know your HIV status. Human papilloma virus is responsible for a lot of cancers that we see in our population, most particularly cervical cancer, and also cancers that involve the genital area, and cancers of the anus, and also head and neck cancers. At the clinic group, we offer the human papilloma virus vaccine, which really is targeted particularly at young children between the age of 9 and 14, but also young adults up to the age of 26 can still be offered this vaccine. Getting this vaccine can significantly reduce your risk of getting, particularly for young women, cervical cancer and any cancers of the genitals. So we do recommend that people, especially parents, go and speak to their medical providers about getting the vaccine for their children. And also young adults, we also do recommend for them to also speak to their medical doctors and inquire about getting the vaccine. I encourage everyone to do regular checkups. Going to see your doctor for regular checkups should be a habit. We shouldn't avoid or fear going to see a doctor because early detection saves lives, and the earlier you get diagnosed, you are more likely to be offered curative treatment. The clinic group messaging is simple: early action, early detection, and early treatment saves lives.